In this episode of Ask the Doc, I got a great question from someone on Instagram that's been suffering and dealing with chronic low back pain for going on 10 years now. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road like pain pills, injections, and surgeries, which only make things worse. So back at it for Ask the Doc. Let's read the full question. I have been dealing and suffering from low back pain going on 10 years now. I just recently went to my PCP to get to the root of what is going on. They told me I need to lose 50 pounds and take some anti-inflammatories. I know I am overweight and need to drop the pounds, but every time I work out, my back feels awful for at least a week. How can I drop the weight if I can't work out? I feel stuck, especially with the answer from my doctor. They blamed everything on my weight, but offered no other causes besides that for the pain. Obviously, I want to lose weight and feel better, but are all of those because I am overweight, or are there other contributing factors? Any advice or insight is greatly appreciated. Thank you so much for sending that in, and I'm sorry to hear you've been dealing with this problem for going on 10 years. I myself have had some significant low back pain over the years to the point where it got really debilitating, so I understand where you're coming from, and it sucks when you don't get real answers from the medical system. I talk about this all the time. The medical system is a complete nightmare full of false promises and lies. And probably the last place you want to go for an injury consultation or trying to figure out exactly what's going on is a primary care physician. They don't get a lot of training in this in school. They're just busy doing a lot of other things, but they think that they know more about injuries, and they give you these type of generic, really just nonsense answers, and you're stuck still having your problem, and they don't have any real answers for you. Everyone wants to go after the effect of like you're in pain, but they don't want to figure out what the cause is happening. And that's why the medical system is broken. That's why opioid deaths are up. That's why people are unhealthy, because there's no actual money in fixing the problem and getting to the root cause of it. So I think there's two camps when it comes to this type of question. You know, there's the one camp which you saw, which is the doctor said, well, it's all based off your weight and you just need to lose weight. Then there's another camp on the other side that's like, well, it doesn't matter that you're overweight. You need to get everything fixed and cleaned up. I think they're both wrong. I don't even think they're both wrong. They are both wrong. Yeah, the weight is a contributing factor, and yeah, you need to get the problem actually fixed and solved with what's causing the issue in there. And both of those types of practitioners are wrong. I've already covered why PCP is wrong on this side, but I've seen other practitioners out there where if you go to a doctor and they tell you need to lose weight, and that's what's causing your low back pain, like run far away from them because they don't know anything. It's only coming from a structural problem. That is wrong. That is dangerous across the board. So my own story, I used to be 100 pounds heavier than where I am now. 100 pounds. I think back on that. I'm like, holy cow. I can't believe I was that big. But I was 100 pounds heavier. And you know what? I had a lot of problems. I had depression. I had anxiety. I definitely had chronic pain, low back pain, neck pain across the board. And I went on a journey to lose all that weight, and I've been able to keep it off. You know, I used to weigh 295 pounds. Right now, as I'm making this video, I weigh 200. Not trying to be like fat shaming or being like, you need to lose weight. But yeah, you need to be healthier. And it's hard. It's not easy to go across the board and do that. And I started realizing how much the extra weight was causing me problems. So when I do my walks, I do a lot of walking. I wear a weighted vest, and it weighs 20 pounds. And I noticed when I got done with the walk and I took that weighted vest off, I was like, man, I'm kind of tired. I'm feeling that. And then I thought the other day, I was like, I used to have 5 more of these on me. Can you imagine walking around with 5 weighted vests on there? It does put damage onto your tissues, onto your joints, onto your discs across the board. Then the other thing you got into, and I've been like this as well, is the exercising hard is the only way to lose weight. It is a total fallacy across the board. People are like, I got to work out hard to lose the weight. It's not the case. This is how I lost all that weight and started. I just started walking. I walked a ton. I started with a mile. Then I went to 2. Then I went to 3. Then I went to 4. And before you know it, I was doing 8 or 9 miles a day. And that was low impact on my joints and got things going. I also started cleaning up my diet. I stopped putting crap in my mouth. I started understanding that I need to eat healthier. I need to take care of my body, make it a priority across the board. Like you said, you want to be healthier. But I think what happens is you default to this, like a cop-out. You're like, well, if I can't work out, I can't lose weight. So then you eat a bunch of garbage and things continue to go. It's a never-ending cycle from where you are. Just start basic. Just get your body moving and just start walking. It might be hard at first, but once you get that movement in and you build up that momentum across the board, you're going to be in a much better place. This injury really needs to be a team approach. First is you definitely need to get your tissue cleaned up. What I end up seeing, the main cause for a lot of these injuries is scar tissue formation in the muscles deep in the low back down through the hips. When that scar tissue forms, it makes the muscles weaker, less flexible, and causes a lot of pain. You need those tissues cleaned up because they're putting more pressure on your joints and discs, causing degenerative disc disease and all that across the board. Some of the best practitioners in the world at finding and fixing scar tissue are Peak Method trained practitioners. You can find links to them in the profile down below. And then also, yeah, you do need some nutrition guidance, not just like some fad diet across the board, something that can be sustainable and you can do it across a long time and not just being like fluctuating from where you are. I've tried all the yo-yo diets, keto, fasting, all sorts of stuff, and went back and forth. And what I found is you have to find the diet, the approach that works for you, that you can continue to do across the board. And you might need to get someone there that can actually help you along that journey. Understand, exercise does not have to be extreme. Just start with basic movements. Get your body moving. Next is slow down your expectations. A lot of people that come in for low back pain that might be 50, 60 pounds overweight, I'm just honest with them. I'm like, hey, this is going to take a little bit longer because metabolically you're not as healthy. People that are overweight, that don't take care of themselves, they know that they can do better. They're not like, oh, I want to be fat and overweight. No, they want to do better, but they've been ingrained in this fallacy of the idea that like they have to just continue to work out really hard, then they get hurt, and then they never go, and it's a never-ending cycle. Lastly, don't give up. Don't. Make your health your number one priority, but focus on one day at a time. I had a client a couple weeks ago that came in and they're like, I need to lose 100 pounds. And I'm like, okay. Well, how are you going to do that? And they're like, I don't know. It seems impossible. I'm like, you know how you do it? You start by losing 1 pound a week. Before you know it, through a year, you're 50 pounds down. So start thinking one day at a time and focus on the future and don't get overwhelmed. Once again, sorry to hear you're dealing with this. The medical system just flat out sucks. But hey, here's where we are. That's why I make these videos, to help educate and inform you so you can take control of your health, can take control of your wellness, and get in a really good place. If you like the video, give it a comment, a like, or share. If you have someone that's struggling with this, share this with them as well. Lastly, if you're having pain, dysfunction, you're not getting real answers, get in touch with a Peak Method provider. They are the best in the world at finding and fixing problems that other practitioners can't. And lastly, if you have a question, I did 2 lastlys there. If you have a question, send it in and we'll add it to the queue for the Ask the Doc and help get you some answers. I appreciate you guys, and I'll see you on the next one. Bye.